Hello, thanks for stopping by for this 2021 Medicare Advantage Clarity presentation. This is going to be some clear answers to Medicare questions for you. This is me. My name is Tom Basie and provide my phone number and my email there. I'll put that at the end as well. I'm here to help today as I run through this presentation. I hope you find it useful and please feel free to reach out to me for further discussion afterwards. I'm best reached at my email. You can try tom.basie@gmail.com. Aparte, yo hablo español, así que puedo atender a la gente en su idioma. So, this is what I'm going to talk about today. Understand your Medicare choices. I will speak briefly about eligibility and enrollment in Medicare. I want to remark about the advantages of Medicare Advantage plans. I'm going to spend several slides talking about prescription drug coverage because that's a point of confusion for folks. Then I'm going to lay 4 Medicare Advantage plans side by side and show them to you, show some differences and similarities between 4 plans so you can get a feel for what's important to you. I will talk about how an agent like myself can provide some assistance to you, talk about some additional resources that can be made available to you. And then finally, I do want to remark briefly about United Healthcare and why you might consider them as a partner in your Medicare journey. So here's the thing, Medicare at the high level, it's from the federal government, thus a red, white, and blue card with a person's name, a unique ID with letters and numbers in it, and then effectivity dates for Part A and Part B. Part A is hospitalization and inpatient care. Part B is for doctor's visit, outpatient things that are not in the hospital. There's a deductible, at least for 2020, and for Part A, it was a little over $1,400, and there was one just under $200 for Part B, outpatient. So there's some deductibles on it. Part A is typically already paid for. It's typically taken out of your paycheck as you work during the year. And then Part B, you do have to pay for it once you join, and typically that's a little under $150 a month. So at a high level, that's Medicare, government-provided health care insurance. Now, having said that, there's a couple things you can do in addition to that to get some additional coverage. For example, those deductibles we talked about. Option 1, you can get a Medicare Supplement insurance policy. Now, that doesn't include any drug coverage, nor does regular Medicare. So then you would add a drug plan. So option 1, get some Medicare Supplement insurance and get a drug plan. Those are available from private carriers. Or you can get an Advantage plan that has drug plan included. It has Part A and B included, and actually has some potential dental benefits we'll talk about more. So you can do either one of these. This one tends to cost significantly more per month, but then has very little out-of-pocket cost. It largely covers what Medicare doesn't. This one can cost typically $0 actually an additional premium per month, but then there will be copays as you go. So one is not necessarily better than the other. We're going to talk through and explain. Spend more time talking about Advantage plans today. Okay, option 1 or option 2. Now, to enroll in Medicare, typically you're 65 years old. There are some exceptions. You can qualify on the basis of disability, for example. But as a general, at 65 years old, typically it's a U.S. citizen. Now there are, again, exceptions, legal resident who's lived in the United States for at least 5 consecutive years. But for the most part, it's U.S. citizens who are 65 years old. Having said that, as you approach 65, there's an initial enrollment period. It's a window of time, not only the month of your birth, but 3 months after, 3 months before, you can go ahead and enroll in your Medicare. In addition, that same time frame, you can enroll in a Medicare Advantage plan or one of those standalone drug plans, perhaps. I do want to mention, you don't have to get a Part D prescription drug plan, but if you don't, there is a penalty. So I'm a proponent of doing that, even if you don't have current medications. If you sign up for Medicare, I'm a proponent of signing up for Part B to avoid this penalty. The penalty is 1 month of the average monthly premium for each month you delay enrollment. So the longer you delay, the more that penalty is. I'm a proponent of doing that, like I say, even if you don't have current medications to avoid the penalty. Okay, now each year, even if you've already got an Advantage plan, annual enrollment period is October 15th to December 7th. You can add or change or cancel and drop back to Medicare. You can make changes during that annual enrollment period. And then if you're on an Advantage plan already, actually you can switch it one time. You can go from one plan to another or go back to original Medicare the first quarter of the year. So those are 2 windows of time. In addition to that initial period, when you can make changes, for example, to Medicare or Medicare Advantage coverage. Now, in addition, there's some other things that might happen during the year. And if these occur, then you get a special enrollment period. If during the year, not in one of those windows, if you retire and lose employer coverage, there's a special enrollment period. You could get a new or different plan. If you move out of the plan's service area, if you already have an Advantage plan, but you move, typically those plans are network-based, zip code, county-based. So if you move to the other side of the state, your doctor wouldn't be in there, so you could get a new plan. There's a special enrollment period for the move. If you qualify for extra help is financial assistance from the federal government. So if you come on hard financial times and you qualify for that, similarly, there's a special enrollment period to make a change to your Medicare Advantage plan. or if you get diagnosed with certain chronic health conditions, maybe diabetes, maybe chronic heart disease might be examples of those. So if any of these things occur, in addition to all those other windows of time I've remarked, you can potentially make a change to your Advantage plan or get on an Advantage plan at that time. Having said that, this is the advantages of Medicare Advantage. Sometimes I call these compelling stats or big numbers too. Over 24 million people have a Medicare Advantage plan in the U.S. Of those, over 90% of them are satisfied with them. So they have them. A lot of people have them. A lot of people are satisfied. And that's because typically they spend 25% less than just on Medicare alone. So those are compelling statistics on why one might consider an Advantage plan. I do want to compare and contrast these. There's original Medicare, there's the Advantage plan. If you notice, they both have hospital stays, medical care like doctor's visits and flu shots. That's basically Part A and Part B. They both have that. What original Medicare doesn't have and what an Advantage plan does have, now there's an asterisk because it varies plan to plan, is prescription drug coverage. Medicare doesn't have that. Routine vision coverage, routine hearing coverage, sometimes routine dental coverage. These are things that some plans have. Medicare doesn't cover that. You can get an Advantage plan that has that. And then limit out-of-pocket costs. There is no out-of-pocket max on Medicare. If you get an Advantage plan, typically there is one. Maybe it's $4,000, $5,000, whatever it is, but at a minimum, you know you're only going to spend that much on your care. If the cost of care exceeds that, the plan will pay for the rest of it. So that's a nice compare and contrast showing how Medicare Advantage has all the things that Medicare doesn't, and then these additional benefits as well. Okay, I do want to remark briefly on these top 10 things. They're not necessarily in order, but they're just important, compelling things that I'd like to at least reiterate. If I haven't said it once already, I probably have. Number one, you must continue to pay your Part B premium. If you enroll in an Advantage plan, even if it costs $0, and many of them do, you still need to pay that Part B premium. If you recall, I said for 2020, that was less than $150 a month for most people. Medicare Advantage has you covered. It's kind of like the top half of that side by side I just showed. It's got all the stuff that Medicare does. That is Part A and Part B when you're enrolled in an Advantage plan. You're not missing anything there. Joining a Medicare Advantage plan may affect your current coverage. I remarked both about a job. If you change job or if you leave a job, you can get on here. There's an implication there. Also, actually, if you're a veteran, you can actually get an Advantage plan and you can keep your VA coverage, for example. There are plans, for example, that don't have drug benefits, so you could continue to get your drugs from your VA, but get certain advantages of an Advantage plan. So you can enroll in both of potentially. You want to pick the right plan. It's best to use network providers. We almost never use the word best in the Medicare world, but in this instance we do because that's simply the case. Some plans can allow you to go out of network for care or maybe for pharmacy, out of network pharmacy or preferred pharmacy, but it says best. It's because it's simply going to cost less if you go in network. You'll save money. You may qualify for financial assistance, either that extra help that I remarked from the federal government or the state and federal government partner for state Medicaid. You can qualify for those, and there's some specific plans that work for somebody who's on both Medicaid and Medicare, for example. If you enroll in Part D late, you may pay a penalty. I remarked that once, but it merits saying again. So I'm a proponent of signing up for some kind of drug coverage. Part D, think of that as drug covers for drugs. Medicare doesn't have it. I think you ought to get that covered, even if you don't take any current medications, because when you get one prescribed, you'll be glad you did. A Medicare Supplement insurance plan, also called a Medigap policy, is not a Medicare Advantage plan. Those are two different plans. That's that option 1 and option 2 that I showed at the beginning. Medicare Supplement doesn't have drug coverage, so you got to get Medicare Supplement plus a drug plan. Both those will cost you, say, $120 a month, $130 a month, something like that, when you first turn 65. But then it'll cover most of the cost, particularly on the cost of care. Or you can do an Advantage plan. Many Advantage plans cost $0 per month or significantly less, but then there'll be more co-pays as you go along. For example, there's potentially a daily hospital cost for the first few days you stay in the hospital on an Advantage plan. That wouldn't be the case on a MedSup plan. So they're different. Keep your member ID card handy. If you sign up for a Medicare Advantage plan, you can leave your red, white, and blue Medicare card at home, and you can take your Advantage plans card to the doctor if you seek care, to the hospital if you're admitted, to the pharmacy if you've got drug coverage on your Advantage plan. You likely do take that in there. If you're going to a dentist or to get an eye exam or anything that your plan covers, you take that card. So that card is a one-stop shop. You carry it everywhere that you seek care, that it has coverage. Medicare Advantage offers the same protections as original Medicare. I kind of showed that side-by-side thing. It has everything got, and then some. And one of the and then some is that last one there. You have a built-in financial safety net. I really like that. And you get that with an Advantage plan. It'll be limited. It varies plan to plan, but be it $4,000, $5,000, $6,000, whatever it is, at least you know you will only spend that much on care that year. The plan will cover everything beyond that. Okay. to talk a little bit about drug coverage, this chart does a very nice job of explaining something that people are baffled by sometimes. And now, for low cost medications, it doesn't necessarily apply. Some Advantage plans, a low cost medication will have a $0 copay, and that's great. But if there's a more expensive plan, what happens here is for the same drug or list of drugs, if they're expensive, over time, if you have that same list and you go to the same pharmacy, it will cost you different amounts. And this chart does a nice job of explaining why that is. So first off, if the plan has a deductible for prescription drugs, well, then by definition, you got to pay the costs until you meet the deductible. So I'll make up an example. If you have a $100 single drug or list of drugs, that's what they cost retail. And if your drug plan has, or Advantage plan has a $300 deductible, well, then in January, February, and March, you're going to pay $100, $100, $100 because you haven't met the deductible. Only once you meet that, then do you kick in and you're in initial coverage. Now, for this rest of this to work, I need to have a more expensive examples. I'm going to say you have a single medication or a list of medications that cost $1,000. If it does, in your initial coverage, I'm going to make up a copay that those turn out to be either for that single medication or the group medications, $100. So in initial coverage phase, your $1,000 bill, let's say you have no deductible on this plan, then your bill or the cost of your medication each month is $1,000, $1,000, $1,000, but you pay $100, $100, $100, $100 each month until you've exceeded this. So by month 5, you'll have already exceeded this amount, and that puts you in the next phase, which is called the coverage gap or the donut hole. At that point, instead of paying that copay of $100 for that same medication at the same pharmacy, now you're going to pay 25% of the drug cost on $1,000. That's $250. So for a few months until month 7, then you're paying that. So for the first few months, you pay $100 a month on that list of medications. Then for the next couple of months, once you've exceeded that, once you're in month 5 or so, you pay $250. And then after month 7, when you've exceeded this amount here, say month 8, and then you're in the catastrophic stage rather. And so that is either these small copays or 5%, whichever is greater. So my example, I'm going to say that's $50. So what I've shown in this example is you've moved through 3 different coverage phases here of this $1,000 cost of medications, where your copay was $100 in initial coverage phase, then you paid $250, 25%, and then you paid $50, 5% of your $1,000 cost of medication. So there's different phases you move through, and notice the total cost, not what you're paying. The total cost determines where you are in that phase. I think this chart does a nice job of describing that. To reiterate, that's total drug cost. That's what you pay plus what your plan pays. That's what determines what phase you're in there, not just what you're paying. And it doesn't include the premium if there's a premium on the plan. That's how to determine what stage you're in. Out-of-pocket cost is what you pay. If you had to pay a deductible, if it had when you meet it, and then your copays. That also doesn't include your premium. So the drug costs are what it costs you as a member of that plan. It's important to make that distinction. Perhaps the most important one is the total drug cost determines where you are in the phases, not what you're paying. A little bit more here. I do want to remark about pharmacy network. United Healthcare has over 65,000 pharmacies in their network. And so the implication is it's likely the pharmacy near you is in that network, or perhaps I might say there's a pharmacy near you that's in network to them. And that's the thing, you simply will save on prescriptions if you go to in-network retailers. So if there's 2 side by side and one is in the network, if you go to one's in network, it's going to cost you a little less. It's very likely that's the case. Actually, another alternative way to save is mail order pharmacy. You can order that, and maybe 30 or 90 days supplies potentially. You can get those delivered to your house. So that's convenient, it's safe, and often it's cheaper as well. So that's 2 different ways you can save by using in-network retailers and/or mail service pharmacy. The drug list for each plan is called a formulary. It doesn't have every single drug in the world, but it's a pretty thorough list. But whatever that list is, got the list of drugs that those plans cover, and they are in tiers. Tier 1 is preferred generic drugs. Tier 2 is generic drugs. Tier 3 is preferred brand name drugs. Tier 4 is non-preferred drugs, and Tier 5 is specialty drugs. And I suspect you might be able to guess that the lower the tier number, the lower the cost, and the higher the tier number, the higher the cost. And every drug on the list is classified in one of those. A couple more things here, almost done with drug coverage. Step therapy is when you try to use a lower cost medication to treat a condition before going and using the higher cost. Quantity limits, as the name implies, where there's only a certain amount of the drug per copay or over a certain number of days. Those are limited, put in place for safety. Then prior authorization, it may be that the plan needs more information from your doctor before they will cover that prescribed drug. So having said all that, you can get exceptions. You can either get an exception if the drug's not on the list. If you're prescribed one, well, that's a formulary exception. Or if you need to waive some kind of the restrictions, that's a utilization exception. In either instance, if a doctor submits an exception request on your behalf, generally the plan will make that decision within 72 hours. And you can get that request expedited and or fast-tracked if the doctor believes your health requires that. So that's all I'm going to say about drug coverage here. Now I'm going to go ahead and show you 4 plans side by side. And I think you'll find this useful because not every plan is alike. There's some similarities between them. I'm just going to compare and contrast these 4 plans. I've got several slides worth comparing these. I would encourage you to think about which of these different features in each plan are more important to you. Which one of these would you choose if these are all 4 and you're available? By the way, these are not necessarily available where you live, but they are going to be representative of plans, one or more plans that is available where you live. So here we go. These 4 plans, I'm going to call it Plan 1 and Plan 2. Those are original plans that have been in the market. This particular market's Dallas-Fort Worth area, been there for some time. Then the Advantage plan and the Choice plan are kind of newer. They've only been in there a year or 2. So these are original plans, newer plans. Plan 1 versus Plan 2, we'll see some of the differences there. Advantage plan is kind of a reformulation of Plan 1. That is, the Advantage plan is a new version of Plan 1. They're quite similar in certain ways, and yet there's some difference. So similar, we're going to look at the difference of all of these, okay? So here we go. The plan premium, actually it's $0 per month for every one of these except for Plan 2. And really what's going on there, Plan 2 is kind of like Plan 1, except when you pay that premium, you drive down your copays, if there are any copays there, and or you drive up some benefits. So that's the main difference between Plan 1 and Plan 2. We'll see that. We'll see some differences between Plan 1 and the Advantage plan. This is a $0 plan, but it is a choice plan. That is, it's a PPO. All 3 of these are HMOs. That means you have to go to carriers, providers that are in the network to seek care. If you go to a carrier that's out of network on an HMO, then the plan won't pay for that. The choice plan, as the name implies, it's a PPO. You have the option to go out of network, but if you recall per previous remarks, it's going to cost you a little bit more, but at least you have that option. You can get care there. You just pay a little more for that. Annual medical deductible on all 4 of these is $0. Primary care visit is a copay of $0 on all these. So those first 2, they're exactly the same. Specialist visit varies a little bit, not a lot, but the Plan 2, which is where you're paying a premium for that plan, it actually has the lowest one of $20 copay. And the highest one is actually $35. The choice plan has the highest copay. That's not a big difference, but it is a difference there. Specialist referral required. That's a yes, yes, yes for the 3 HMO plans. It's a no for the PPO. So not only does it allow you to go out of care, out of network for your care, it also allows you to doesn't require you to get a referral to go to see a specialist. So this plan is flexible. That flexibility costs you a little bit more, but it is flexible. $0 per month. It costs you more on copays as you seek care. Preventative services are $0 copay on all 4 of these plans. So far, there's not been a lot of difference financially between these 4 plans. Here's one of the most significant ones. Inpatient stay. If you go to the inpatient stay, where you're paying Plan 2, where you're paying that premium, there's just a $150 copay. That's all you got to do for that hospital stay. On these other plans, the $0 premium plans, it varies slightly. On Plan 1, you pay $275 a day copay for days 1 through 5 that you stay in the hospital. Once you go past 5, then it's a $0 copay. For the next 2 plans, the newer plans, it's actually $325 instead of $275, and it's actually a day longer. Day 6, you have to pay that before it drops down to $0 copay. So the newer plans cost you a little bit more per day in the hospital to stay. Skilled nursing facility, actually all 4 of these plans have a $0 copay for the first 20 days. Then what varies, the daily copay is the same for all 4 of these plans, $184, but the number of days you pay that varies. Plan 2, where you have the paid premium, has the lowest number of days you pay that. You only go to day 38 before it drops to a $0 copay in the skilled nursing facility. Plan 1, and remember the Advantage plan is kind of a new formulation of Plan 1. They both go to day 42. Did you pay $184 a day? On the flexible plan, the PPO plan, you have to go all the way to day 57. You're going to be paying $184 a day before it drops down to $0 after that. So you're seeing a trend here already. You get more on this plan because you're paying a monthly premium. This one costs you more to have that flexibility. Outpatient surgery, there's a little bit of difference. It corresponds to the kind of the daily rate in the hospitalization one. The one with the lowest copay, max copay for outpatient surgery is the paid plan. The one that has the highest are these newer plans. Their max copay is $325. Diabetes monitoring supplies and home health care all have a $0 copay on all 4 of these plans. So already I think you're getting a feel for this. We're going to look at some more to understand this more thoroughly. Here's some more benefits of these plans. Diagnostic radiology services, for the original plans, it was $125 max copay. It has gone up a little bit. It's $150 max copay for the newer plans. Diagnostic test procedures, older plans have $20 copay. The newer plans have a $25 copay, a little bit. Lab service is a $0 copay on all 4 of these plans. Outpatient x-rays is $0 copays on all 3 of the HMOs. There actually is a $15 copay on the PPO, the flexible plan. Ambulance is the same, be it ground or air. It's the same on all four of these plans, a $250 copay. That's it. Emergency care, similarly, it's a $90 copay on all four of these plans. No big difference there. Urgent care, there's a slight difference. Whether it's contracted or not, it's a $40 copay on the HMOs. They're actually a little bit cheaper on the PPO. It's actually a $30 copay only if you go to a contracted urgent care location. Now, here's the biggest single financial difference, the total out-of-pocket max. For Plan 2, you have the lowest one. It's $3,200 out-of-pocket max. The other two HMO plans have $3,900 out-of-pocket max. For the PPO, the flexibility to go out-of-network, it has a $6,700 out-of-pocket max. Once again, cost you a little bit more for paying for that flexibility, if you will. And then if you're paying a monthly premium, you have the low, you're kind of getting more benefits or lower copays. Okay, a little bit on drugs. I'm not going to read this whole thing, but basically what our offer is Tier 1, the generic things. There's a $0 copay for Tier 1 on Plan 2. There's a $2 copay on Plan 1, and there's a $3 copay on the flexible PPO plan. So that mirrors what we've already talked about. If you look down at the deductible here, $0 copay for all tiers for the HMOs. For the PPO plan, that $0 deductible only applies to Tier 1 and Tier 2, the lower cost drugs. The more expensive drug, there is a $345 deductible for Tiers 3, 4, and 5. Okay, now these are some additional services or features of these plans. Some dental coverage. For Plan 1 and for the flexible plan, you get $500 of covered dental services, kind of commonly used stuff, x-rays, routine cleanings, and fillings. For the plan where you pay a premium, and for the new reformulated Plan 1, the Advantage plan, you actually get $1,000. So you get some more dental on Plan 2 and the reformulated Plan 1, if you will. Routine vision care, actually on all four of these plans, it's a $0 copay for an eye exam every 2 years. It's only $100 allowance for three of the plans. The plan where you're paying that additional premium, you actually get an additional $100. It has a $200 allowance for eyewear every 2 years. The original plans had some nice hearing coverage, $0 copay for a hearing exam every 2 years, and then some copays. They actually have a spectrum of hearing aid products they offer, but some of them as low as $175 copay for hearing aids. There is no hearing coverage in the newer plans. So the main differences, besides slight difference in the cost of hospital stay between Plan 1 and the Advantage plan, there's more dental on the new version on the Advantage plan, but there is no hearing. So it's kind of which one of those is more important to you, might make you select one of those versus the other. Insulin Senior Savings Program is the same for all four of these plans. You can get a month's worth of insulin for $35 or less. Over-the-counter benefit. Now, this is counterintuitively, perhaps, this is available on three of the plans, but not the one where you're paying the monthly premium. On these other three plans, it says $160 a year. It's actually $40 a quarter, but they give you credit for $40 a quarter. You can via phone or via internet. There's a catalog full of over-the-counter products like what you might get at a local pharmacy for over-the-counter, not prescription things. So be it aspirins or allergy medicine, maybe some anti-digestive things, maybe even Band-Aids, personal care stuff that you might find over-the-counter in a pharmacy. You can order that and they give you $40 credit per quarter. So it's a pretty nice benefit. And then also you get a membership in Renew Active. And what that translates to often is a no-cost gym membership. Kind of like the pharmacies. Can't say every single gym takes it, but there are many gyms that participate and accept Renew Active, and that will result in a $0 gym membership for you. So having said all that, we've looked at all four of these plans. This is merely just the plan numbers and the counties they're accepted in. It's not that important. The important thing is to recognize if you live in Dallas-Fort Worth area, these plans are available to you. If you live in another part of Texas or in another state, there's likely some similar plans. The dollar values might vary perhaps, but some of these same features are likely available in some plan near you. So having said that, I did remark a little bit about United Healthcare at the beginning here. They have over 40 years serving the Medicare community. There may be other carriers that offer Medicare plans, but I don't know if they have 40 years serving the Medicare community. As a result, more people have Medicare, United Healthcare for their Medicare plans than any other provider. And also, I kind of mentioned that 93% satisfaction rate. People like them. So United Healthcare has over 40 years doing this. More people choose United Healthcare than the other. The people are very satisfied. And then it says you have our promise and commitment to helping you live a healthier life. I can kind of attest to that on behalf of United Healthcare. Sometimes I staff a kiosk at a local pharmacy, hang out there and just answer questions about Medicare for people there, remind them to use the over-the-counter benefit. So they really do care about Medicare beneficiaries. Oops. Having said that, these are some additional resources that can be made available to you. Medicare Made Clear can be an electronic or a hard copy. It's similar to this presentation, actually, just kind of help you understand option 1 and option 2, part D. So it's a nice resource for Medicare, and it comes from United Healthcare. Medicare helpline, you can dial 1-800-Medicare, or you can go to Medicare.gov and speak to someone at CMS. That's the government organization that administers healthcare, and they can provide you help and guidance and information. Medicare and You is a big, thick document that they used to send to every person turning 65 in the U.S. I don't know if that still happens, but it's a nice, big, thick document. We can get one of those to you. Online plan finders, those plans that I was showing you, you can go online and see a bunch of ones that are available in your area. State resources, you can check your eligibility, even apply for example, Medicaid if you're in need of financial assistance, that's available. SSA.gov, the Social Security Administration, not unlike Medicare, they're available online and by phone. They can provide help. You know, if you sign up for both of them concurrently, and that one of the things they're going to ask when you get Medicare, hey, how are you going to pay for your Part B premium? You can say, take it right out of my Social Security benefits if you're doing them both simultaneously. It's kind of just an example. You don't have to do it that way. And then administration and elder care, low care, you can find all kinds of help, home health care, elder care. Those can be located online as well. So there's a bunch of resources available. What I would offer is, I'd like to help. I'd like to help you find those resources and utilize those resources on your Medicare journey. If you give me a list of doctors, I can take that list and look and show you and confirm that they take the plans, because you don't want to sign up for a plan that your doctor doesn't accept. So we can check that. Prescription, you give me a list of medications and I can show you how much they will cost kind of based on their tier, even not only the tier, but even across pharmacies in your area. We can kind of look at the pricing so you can optimize that. Select pharmacy. If you love a pharmacy, show you how much it costs there. I can show you how much you'd save if you switch pharmacies potentially, how much you're saving. Additional resources, I can help you find a gym near you that accepts the no-cost gym membership part of Renew Active. More benefits, I can check your Medicare eligibility. There's some feature-rich plans for people who are both on Medicare and Medicaid. And then this is for veterans. Actually, I can help you find a plan. For example, like I say, you can keep your TRICARE VA benefits, get your drugs from the VA, but get one of these plans and then go to the dentist network near you or get your no-cost gym membership. So I can help you take advantage of that. So I'm here to help. To reiterate, that's my name, Tom Basie. My phone number's there. Love the email reach out, tom.basie@gmail.com. Let me know how I can help. Aparte, les comento otra vez que yo hablo español, así que puedo entender a la gente en su idioma si se siente más a gusto. So I'm grateful for your time today. I hope this has been beneficial. Please do not hesitate to reach out to me if I can provide further information.